Did you know that over 50 million people around the world are living with dementia, and most of them don't even realize it until the disease has progressed too far? Statistics show that about 60% of dementia cases go undiagnosed until the later stages, when the brain has already suffered significant damage, and the person's life and the lives of their loved ones are greatly affected. Have you ever noticed yourself forgetting names or misplacing things often? These could be warning signs. The good news is that early detection of symptoms can change the entire course of the disease. Hello, I'm Dr. Ethan Hale. Today, I'm going to talk to you about the most common early signs of dementia. I truly believe that awareness of these signs and early detection can help you or your loved ones save a life. By the end of this video, I'll share some prevention strategies that actually work. So, if you want to keep your brain healthy and stay sharp for as long as possible, be sure to watch this video all the way through. If this topic interests you, make sure to give it a thumbs up, and let's dive in. The first thing I want to talk about is memory problems. Let's break down why we might forget recent events, but still remember what we had for dinner at a wedding 30 years ago. Imagine you just put your keys on the kitchen counter, but 5 minutes later, you can't find them. You search the house, even checking the fridge, and surprise, there they are. How did they get there, you ask yourselves? This might seem funny, but if it happens too often, it could be a troubling sign. Memory problems are one of the most common early signs of dementia. This happens because, in the early stages of dementia, it's the short-term memory that suffers first, the kind that holds on to recent events. What happens is, our brain starts to forget how to record new information, as if the function to store data stops working. You can remember how you celebrated Christmas 20 years ago, but you can't recall what you had for breakfast this morning. At first, you might not think much of it and chalk it up to age, fatigue, or stress. But when these moments become regular, they can start to affect your daily life. So what can you do about it? Here are a few simple but effective steps. Exercise your memory. Play games that require you to remember things, like card games, or try learning new words. Ask your loved ones for help. Share your observations with them, and ask them to remind you about things if you forget. As a doctor, I always recommend that if you're experiencing regular memory lapses, especially if it's noticeable to others, don't delay in seeing a doctor. Sometimes it could be related to a vitamin deficiency or stress rather than dementia, but only a professional can make a definitive diagnosis. We've covered short-term memory issues, but that's just one signal to pay attention to. Struggling to find the right words or frequent pauses in conversation could be another early sign. Let's take a closer look at this. Imagine you're sitting with friends over a cup of tea, and suddenly you can't remember the word you wanted to say. Instead of the right word, you say thingy, or what's it called? And everyone around you starts nervously trying to figure out the word for you. Sound familiar? It happens to everyone, but if it starts happening more often, it might be time to think about it. When we speak, our brain quickly finds the words we need. We see them in our memory, like books on a shelf, and pull them out when needed. But what happens when that shelf becomes overcrowded or hard to reach? This leads to trouble finding words. It's one of the early signs of dementia. Replacing simple words with phrases like that thing, or having frequent pauses when you can't recall the right word, could be a sign that your brain is losing its ability to quickly link words with the right objects or actions. So how can you help yourself and your loved ones in this situation? Here are a few simple strategies. If you forget a word, don't panic. Take a pause and think calmly. This helps your brain settle down and find the right word. Talk about it with your loved ones. If you notice this happening often, don't hesitate to mention it to them. It's important that they're aware of your observations and can support you in difficult moments. As a doctor, I always remind my patients that if word-finding difficulties become regular, it could be an early sign to see a doctor. Sometimes speech problems can be caused by other factors, like stress or fatigue, but it's important to rule out more serious causes. Now that we've covered speech difficulties, let's talk about sleep problems. Have you ever woken up in the middle of the night and couldn't fall back asleep? Or on the flip side, felt tired even after a good night's rest? These sleep disturbances are one of those signs that not many people talk about, but they could be linked to the onset of dementia. When our brain starts struggling to process information, it also affects processes that regulate our biorhythms, including sleep. Don't just brush off insomnia or daytime sleepiness as aging or stress. It could be a sign that your brain is having trouble regulating sleep. Sleep is incredibly important for brain cell recovery and memory improvement, and disruptions in sleep can worsen cognitive issues. Let's talk about what you can do to improve your sleep quality. Stick to a schedule. Try to go to bed and wake up at the same time every day, even on weekends. This helps your body get used to a regular cycle. Create a comfortable sleep environment. Make sure your bedroom is quiet, dark, and cool. This promotes better sleep. Avoid stimulants. Don't drink coffee or tea before bed, as they can interfere with your ability to fall asleep. If sleep issues become regular, don't hesitate to see a doctor. Sometimes insomnia or restless sleep could be linked to depression, stress, or other conditions. As a doctor, I want to stress that sleep problems are not just an inconvenience. Sleep disturbances can amplify cognitive issues and make them more pronounced. So, it's important not to ignore this symptom. Treating sleep problems can significantly improve quality of life and slow the progression of dementia. Now that we've talked about sleep, let's discuss physical changes like slowed movements or tremors. Have you noticed your hands shaking more often? Or do you feel like you're moving more slowly? As we age, small changes in physical health are normal. But when slowed movements or tremors become more pronounced, it could be a sign of the onset of neurodegenerative processes. In these cases, the brain starts losing its ability to send signals to the muscles quickly and in coordination, and movements become less smooth. If you notice slowed movements or hand tremors, it's important not to ignore it. Understanding that these changes could be related to neurodegeneration allows you to take action sooner. The earlier you get an accurate diagnosis, the more likely you are to slow down the progression of the disease and maintain quality of life. Let's discuss what you can do to help yourself. Simple exercises or walks outside can help keep your muscles toned and improve coordination. Try doing crafts, solving puzzles, or playing board games that require precision in movement. This can help improve coordination. Don't hesitate to use special tools like pens with comfortable grips or adapted utensils. As a doctor, I always tell my patients that if symptoms like tremors or slowed movements become regular, it's important to consult a specialist. Sometimes it could be linked to conditions like Parkinson's disease or other neurodegenerative disorders that require treatment. But only a specialist can make an accurate diagnosis and recommend the proper therapy. Now that we've covered physical changes, let's talk about a problem like apathy, which can also point to brain issues. With apathy, you lose interest in hobbies or social interactions. You just don't feel the strength or desire to do the things you once enjoyed. Everything seems uninteresting, and even spending time with loved ones stops being enjoyable. As we age, our preferences and priorities may change, but when apathy becomes a regular feeling, it could be a sign of brain issues. When cognitive functions start to change, the ability to experience emotional responses and joy from familiar activities weakens. Your brain loses the ability to feel these things, which is why you may lose interest in activities that once brought you joy. What can you do to fight apathy? Here are a few helpful tips. Return to your favorite activities. Even if you don't feel like doing your hobby, try doing it just a little bit. For example, if you once enjoyed reading, try reading a little, but regularly. Spend time with loved ones. Hanging out with friends or family can reignite your interest in socializing. Even a simple conversation can give you an emotional boost and make you feel more alive. Engage in physical activity. Simple walks in the fresh air can significantly boost your energy levels and improve your mood. This helps keep both your brain and body active. Now let's talk about difficulties with performing everyday tasks like cooking or cleaning. These changes can also be linked to cognitive impairments. Imagine you're about to make lunch. It used to be your favorite part of the day, chopping vegetables, cooking meat, setting the table, but suddenly you notice that you forgot what to do next, or you can't remember how to chop vegetables or how to turn on the stove. These simple tasks suddenly seem complicated and overwhelming. This may not just be fatigue, but a sign of a problem related to cognitive functions. When a person begins to have difficulty with routine tasks like cooking or cleaning, it may indicate that their brain is struggling with the usual cognitive load. The brain loses its ability to properly process information and coordinate actions. So what can you do to cope with these symptoms? Make notes, create lists, or even write down step-by-step instructions. This will help you remember important details. Use reminders. your phone or special devices can remind you about things to do during the day. If you notice that you can't manage routine tasks, don't hesitate to ask your loved ones for help. Break tasks down into steps. This will help reduce the memory load. As a doctor, I want to remind you that problems with performing regular tasks should not be ignored. Early intervention through diagnosis and treatment can significantly impact quality of life and slow the progression of the disease. Now that we've discussed difficulties with performing everyday tasks, let's talk about another symptom that should not be ignored. Frequent falls and balance issues while walking, which could indicate motor function decline. Imagine you're going for a walk in the park and suddenly feel your leg give way, and you unexpectedly lose your balance and fall. At first, you might think it's just an accident and that you simply stepped on an uneven surface. But over time, such falls become more frequent. This is a warning sign because balance issues can be linked to changes in the brain. Falls and loss of balance can result from changes occurring in the brain that affect motor coordination. Usually, we don't think about how we maintain our balance because our brain automatically controls our movements. But with disorders like dementia, motor and coordination problems become more pronounced. This may be due to weakened connections between the brain and muscles, making even normal movements like walking more difficult. Frequent falls can lead to serious injuries, such as fractures and sprains. So in such situations, don't delay in visiting a doctor. The sooner you start taking action, the easier it will be to control the situation and prevent further progression of the problem. What can you do to improve motor function and reduce falls? Regularly perform simple exercises and be more physically active. Walking, yoga, or dancing can help strengthen muscles and improve coordination. This helps the brain control movements more effectively. If you feel that it's difficult to move around on your own, use assistive devices. Consider using a cane. Be mindful of your surroundings. Try to remove any obstacles in your home that could cause falls. Work with a physiotherapist. A specialist can suggest exercises to improve coordination and reduce the risk of falls. Now let's talk about disorientation. Losing orientation in familiar places can also indicate brain problems. Imagine you walk into your home. Everything seems to be in its place, and you know exactly how to get to your living room. But suddenly, you feel that something is off. You can't remember how to get to your bedroom. You notice that the familiar path seems unfamiliar, and this causes a feeling of anxiety and even fear. Such moments of disorientation can be the first sign that changes are occurring in your brain. During disorientation, a person loses the ability to properly assess their location or navigate familiar places. This may manifest as forgetting where you are or doubting the correctness of your path, even if you've walked that route many times before. With dementia, the brain begins to lose its ability to function effectively, and one of the first functions affected is spatial orientation. This occurs due to the destruction of brain cells responsible for memory and the perception of the surrounding environment. While such episodes may be temporary and not always indicate a serious problem, recurring episodes of disorientation can be a warning sign that requires attention. Loss of orientation is one of those signs that can be easily overlooked. However, if these episodes become more frequent, it's important to see a doctor. The earlier the diagnosis, the better the chances for successful intervention and preventing more serious cognitive impairments. Can anything be done in such a situation? There are several things you can do to minimize disorientation. Create landmarks. Place bright markers in key locations, such as on the door frames of rooms, to help remember where you need to go. Get used to regular routes. To minimize the risk of disorientation, try to stick to the same paths. Use reminders and cues. If you feel uncertain in familiar places, don't hesitate to use notes or mobile apps to remind yourself where you are and where you need to go. Be cautious in new or unfamiliar places. If you're in a new place, it's important to be especially attentive and move slowly to avoid falls and other injuries. We've just discussed the problem of disorientation, which can be an early sign of dementia. Now, let's talk about losing interest in socializing. Avoiding conversations and social events is a psychological signal that should be taken seriously. Imagine you used to love spending time with friends and family, sharing stories, laughing, and discussing the latest news. But lately, you've noticed that you often avoid meetings, don't want to engage in conversations, and feel that socializing has become a burden. You may even start avoiding calls or messages from loved ones. When such changes occur, they are often related to the deterioration of cognitive functions, such as memory and perception. For people with dementia or other brain-affecting conditions, communication becomes difficult because they can't express their thoughts clearly or remember what they wanted to say. This can lead to social isolation, which in turn can worsen the symptoms of the disease. Socializing is an important part of our lives, and losing this ability can have a profound impact on quality of life. People experiencing difficulty communicating may become more withdrawn and isolated, which can negatively affect their emotional state. If you notice that an elderly person starts avoiding socializing or can't keep up with a conversation, it's a cause for concern. The earlier such changes are noticed, the easier it will be to address them and improve the person's life. What can you do to help someone in this situation? Or, what can your loved ones do for you? A few steps can help in this situation. Try talking to the person about topics that interest them. Start with small, casual conversations. If the person has trouble finding the right words or continuing their thoughts, don't rush. Be patient and allow time for reflection. Pay attention to social activities. Shared hobbies or group activities can help a person feel part of a community. As a doctor, I understand how important it is to maintain social connections and not remain isolated. This helps preserve good emotional health. We've just discussed the importance of maintaining social communication and the need to notice its loss in time. Now, let's talk about how you can actively care for your health. In the next part of this video, I'll share effective preventive tips that will help keep your brain in good condition and reduce the risk of dementia. Prevention is always better than treatment, and fortunately, there are several simple yet effective steps that can help preserve mental clarity for many years. Don't underestimate the benefits of physical activity, so make sure to exercise regularly. Research has shown that regular exercise, such as walking in the fresh air, can significantly reduce the risk of dementia. Just 30 minutes a day can improve blood circulation, stimulate neuroplasticity, and maintain brain health. Go for a walk in the park, swim, or even practice yoga. The key is not to be lazy, and your brain will thank you. Like muscles, your brain needs training too. Constantly learning something new helps strengthen neural connections and slows down age-related brain changes. This can be anything: solving puzzles, crosswords, playing chess, or even learning foreign languages. Socialize to maintain mental clarity, because social connections are crucial for our emotional well-being. Support from friends and family, as well as active participation in community events, not only improves mood but also supports brain health. Take care of quality sleep, because sleep is the time for the body to recover, including the brain. Recent studies have shown that chronic insomnia can contribute to cognitive decline. Aim for at least 7 hours of sleep per night, creating a calm sleep environment. Avoid smoking and limit alcohol. Smoking and excessive alcohol consumption can seriously damage the brain. Tobacco and alcohol have toxic effects on neurons, which can accelerate the aging of the brain and increase the risk of dementia. If you want to prolong mental clarity, I strongly recommend quitting smoking and limiting alcohol intake. To summarize everything we've discussed in this video, I want to remind you that early recognition of dementia symptoms can significantly improve quality of life. Pay attention to your health and notice any changes, even if they seem insignificant. Timely action is key to preserving mental clarity. I hope this video was helpful for you, and you learned something new. If you have any questions or suggestions, feel free to leave a comment under the video. I promise to respond to everyone who reaches out. It's important that we help each other with health and longevity. If you liked this video, please give it a thumbs up. Your support means a lot to me. And don't forget to subscribe to the channel so you don't miss the next useful episodes. Also, I recommend you watch the next video, the icon for which has already appeared on the screen. Just click on it, and you'll learn even more helpful information. I wish you good health and a clear mind. See you in the next videos.